From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus, North Carolina News Brief for Monday, April 27th, 2020. I'm Cliff Baumgartner. Here's the latest from WREL.com. Under pressure from advocacy groups and media organizations, today North Carolina health officials have released details for the first time on the locations of dozens of nursing homes and other group living facilities with COVID-19 outbreaks across the state. The move marks a significant policy reversal for the North Carolina Department of Health and Human Services, which for weeks has maintained that identifying facilities with outbreaks would reveal confidential health information for particular patients. As of Monday, DHHS reported more than 2,500 cases of COVID-19 and more than 150 deaths from the disease in so-called congregate living settings, which include nursing homes, prisons, and residential care facilities. Infections in those settings account for more than 1/4 of the state's total cases and more than half of all deaths. North Carolina joins just a handful of other states, including Georgia, California, Ohio, Illinois, and New York, that disclose at least partial details about the location of deaths and cases in nursing homes and other group facilities. You can find specifics for this information on our website. Over the next month, the state of North Carolina will double the number of people trained and employed to trace contacts and those exposed to coronavirus. Tracing is essentially following in the footsteps of anyone who tests positive for the virus to see where they went, who they interacted with, and for how long. The state will need 500 trained tracers by the end of May, according to officials. They will be hired in collaboration with Community Care of North Carolina. Dr. Mandy Cohen, Secretary of the North Carolina Department of Health and Human Services, encouraged people with a background in community engagement to apply for these jobs immediately, saying, quote, "Special consideration will be given to those who are unemployed, have community engagement experience, and live in the communities that they will serve," end quote. Most current tracing is done through phone interviews, but researchers from Apple, Google, and the Massachusetts Institute of Technology are working on Bluetooth phone apps to detect close proximity to known positive cases. Each method has its pitfalls, though. Phone interviews rely on a person's memory about where they went and who they interacted with. The use of smartphone apps would be voluntary, and some people may resist because of privacy concerns. Today, Carteret County reopened all county-run beaches, including Salter Path, Radio Island, and Harkers Island. Beachgoers are warned to practice social distancing and avoid mass gatherings to prevent spreading coronavirus. Meanwhile, Carolina Beach opened at noon for sport and exercise only. Sunbathing, gatherings, and beach equipment like umbrellas, coolers, and blankets will not be allowed. Wrightsville Beach is operating under the same rules. The CDC has added 6 new symptoms for COVID-19 to their list of potential symptoms. The original list of symptoms, according to the CDC, included fever, cough, and shortness of breath or difficulty breathing. Now, the CDC has also added the following symptoms: chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. The CDC is advising individuals who think they may have the coronavirus to stay home, separate themselves from others, and call their doctor before seeking medical care, except in the event of an emergency. Lastly, a bit of good news. Thousands of dollars have been raised to help North Carolina restaurant workers in need. The North Carolina Restaurant Workers Relief Fund has raised $750,000, organizers announced today. The fund has also been able to help more than 1,000 restaurant and hotel workers affected by pandemic-related layoffs. Applications were cut off at 15,000 people, with thousands added to a waiting list. Donations can be made online at ncrestaurantrelief.com. This has been your Coronavirus North Carolina News Brief for Monday, April 27th, 2020. As always, if you like the show, let us know by giving us a rating and review wherever you listen. And while you're there, be sure to subscribe so you don't miss our brand new episodes. Thanks for listening.